Week 2's mobility and flexibility session, and what we'll be focusing on today is the spine. So we're going to be going through exercises that are going to mobilise your lower back and your middle of the back and upper back. And these can get quite stiff due to work, if you're training too much, or if you're not training at all, then your body can become quite stiff. So this is really good for getting more mobility within your upper and lower back, basically. So what we do, we'll run through some stretches, but also some movement exercises. We're going to start off with one exercise I give to people quite often who have got low back pain. So this is going to be a sort of progression from a seated position into standing. So what we'll do, we'll start off in a seated position. So if you don't have one already, grab yourself a chair and just put it on pause, and then we'll get started. So you're going to be sitting on the edge of the chair, and all you're going to be doing is you're going to be bending down 10 times, and the outward breath is on the downward motion, okay? So you're going to take a deep breath in, and you're going to lean forwards, breathing out, breathing in on the way up, and then out on the way down. In on the way up, out on the way down. So what you're going to try to do is relax as much as you can. What people tend to do when they've got back pain is they tense up. So you want to try to relax as you're going down. And deep breath in on the way up. We'll go for 4 more. 1. Breathing in. 2. Breathing in. Breathing out. 3. Last one. Okay, good. So that should help get you started. So the next exercise will do exactly the same but in standing. So you want to be curling down from your chin first, middle of your back, and then lower back. And then when you come up, curling up from your lower back, middle of your back, and then upper back. Okay, quite difficult if you've not done it before, but just give it your best shot. So we're going to go for 10. Breathing out on the way down. Breathing in on the way up. So you'll find that you get tightness in your hamstrings as well near the bottom. And you might feel a pulling sensation in your lower back. Good. Number 3. 4. 5. Each one, you might start to feel like you're getting a little bit further and you can reach closer to your toes. Try not to bend your knees, keep your knees straight. If you bend your knees, you take the stretch off. So just keep that stretch on. Don't worry if you don't get to your toes. 2 more. Last one. Well done. Okay, so now we're going to do some side bending. So you're going to be side bending to your left and then side bending to your right. And we're going for 10 each side. So this is 2, 3, 4. Keep that breathing going. Nice and consistent. In through your nose, out through your mouth. I think this is 6, 7, 8, 9, 10. Okay, so those first 2 movements are predominantly for your lower back. This next one, rotation, is more for the middle of your back. You've got a lot more rotation going through the middle of your back than you do lower back. You have some in your lower back, but there's a lot more in the middle. And that's mainly due to the shape of the joint. So your thoracic spine, which is the middle of your back, the joint angles are like this, which allow that rotational movement, whereas your lower back joints are a little bit more straight on. So they have an angle to allow some rotation, but they mainly allow forward and back motion. Okay, let's keep going, a couple more. Might feel there's a bit of tightness in the middle of your back when you do this. Okay, well done. So this exercise that we're doing next is going to be working or getting your shoulder blades moving forwards and then drawing your shoulder blades back. At the same time, you should find that your upper back will extend as you come back, and then bend forwards as you go forwards. Bit of a technical term, extending means straightening, and then flexion means bending. But predominantly, it's your shoulder blades that are moving. So it's getting all those muscles around the middle of your back stretched, and then contracted, tightening up. Okay, let's keep going. Go for a few more. Okay, last one, forwards and then back. Good. As you can see, sometimes I'll stop counting and I don't have a clue where I am. So we're trying to aim for around 10. We might not always get that, we might get a couple extra as well. Okay, so next exercise we're going to do is the prayer and Cobra. So we're going to combine the two exercises, and if you haven't done this before, this is a prayer. So you're going to be sitting back onto your heels, sinking your chest down and stretching your arms out. You might feel a stretch in your ankles, in your knees and your lower back, okay? So from here, you're going to be walking your hands forwards a little bit if you need to, and then you're going to drop your hips down, lift your chest and draw your shoulder blades away. Okay, so then you're going to go back into your prayer, walk your hands back a little bit, sit into your heels, and then come forwards, hips down, chest up, draw your shoulder blades away from your ears. People tend to do this. Try and push your shoulder blades away. Okay, let's go for another 10. Hopefully you've got the movement. So this is working your lower back. So this is mobilising your lower back. Okay, this is number 2. Number 3. Might get a few clunks and clicks as you go through the movement. As long as there's not pain associated with those clunks and clicks, don't worry about it. And even if there is some pain, if that pain isn't getting worse and it settles down really quickly, then again, not something to worry about. It's likely to be because of stiffness. If that pain is getting worse each time, then definitely don't keep going. And if it's one motion more than the other, so you might want to just do the prayer movement, like going back into the prayer, going back onto all fours. If it's the prayer movement that's giving you pain that's getting worse, then just do the Cobra, back up to all fours, and Cobra. And in the coming weeks, you might find that you can do both with no problem. We're not here to make things more painful, we're here to make things less painful and more mobile. Okay, let's go for a couple more as I've lost count, because I've just kept talking the whole way through. Okay, last one, back, and then forwards. Draw those shoulder blades away. Okay, if you want to, grab a little drink, because even though it's not high intensity, it can still get a bit hot, and you might need a little drink. So grab a drink, and we'll move on to the next one. So what you're going to be doing now is you're going to be kneeling, and it's called thread the needle. So this is more so for your middle and upper back, not your lower. It does work, it does stretch your lower back, but more so the middle. So you're going to be reaching under, and then you're going to be stretching up into the air. And I'll show you this way. So reaching under and up, under and up. Okay, so let's go for 10. You ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, change arms. So now reaching under with your left if you started with your right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Brilliant. Okay, if you need to, sit back on your heels, just stretch your lower back out. I just started to feel a little bit of tightness as I was doing it, so if you do feel like you get a bit tight there, this is quite a nice stretch just to loosen off. Okay, so we're going to do an alternate sort of prayer stretch now. So rather than sitting back on your heels, you're going to be bringing your hips above your knees, okay? Your hips need to stay above your knees. You're going to stretch your hands out as far forward as you can and try and lower your chest to the floor. So you're likely to feel this in your shoulders and between your shoulder blades, okay? If your hips are going backwards, you're not going to get the same stretch. So you need to keep your hips above your knees and then push your chest down. So we're going to hold this stretch. That's it. Go for another 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, quite a sore one, so just shake your arms off, loosen the arms off a little bit. It can be quite uncomfortable, so with that exercise, or with any exercise that's quite uncomfortable, ease into it, don't force it. Okay, I'm going to get you now to be sitting with your legs crossed. Something you might not have done for a long time, but you're going to be sitting up nice and tall. You're going to place one hand on the outside of your knee, and the other one is going to go as far round behind you as you can without you sinking forward. You want to lift your chest. Okay, and what you're going to do is use your hands to just gently rotate your body round. Keep lifting your chest as you do it. So I'll show you side on. Lifting the chest, rotating. That's it. Nice deep breaths as you do it. If you feel like it's starting to get easier, then just increase the stretch by pushing on the outside of your knee and then just gently pulling your body round with the right hand. Okay, good work. So it can be quite sore in the middle of your back there, so ease into the stretches, don't force them. Okay, so now you're going to swap legs round, so you're going to cross the opposite leg round. Probably feel really alien now because we've always crossed our legs in one way. So a hand on the outside of the knee, other hand behind your back, lift your chest and then gently rotate round. Nice deep breaths as you do it, keep lifting your chest. If you force the rotation but slump, you're not going to get the same stretch. So lift your chest and just gently turn. Okay, great work. Right, similar sort of thing, we're going to be doing some rotational movement. So you're going to have your one leg straight, so you start on the left leg, you're going to lay on your back, you're going to lift the right knee and roll it over to the floor, okay? I want you to keep going until your knee's on the floor. Then you're going to take your right arm and, so first of all, sorry, you're going to place your left hand on the outside of your right knee to keep it down. And then you're going to lift the other arm up and then gently rotate backwards. Sometimes you might feel a little clunk in your lower back. That's not something to worry about. Can be quite relieving. If you don't get it, it's not a problem. The idea is you're feeling a stretch. So you're likely to feel this stretch in your hip, your lower back on the side of your lower back up into your ribs, and then sometimes people feel it quite intensely in their shoulder. If you feel it there, then just pop your hand on your chest and then rotate your shoulder blade down. If You can use the arm as a little bit of leverage to rotate backwards. You'll get more of a stretch through your hip and back. Okay, lovely. Right, let's change sides. So this is going to be our last stretch. So as I say, I'll turn around again just so you can see. So now we've got our right leg straight. The left knee, is going to go down to the floor. You're going to place your right hand on the outside of your left knee and then reach the left arm backwards. Rest your head on the floor. Try and draw this knee up as high as you can towards you as well. So that's going to add to the stretch. Nice deep breaths. As you breathe out, you might find you can just rotate around a little bit more. Okay, well done. If you want to, bring your knees up into your chest. That will help you just relax a little bit into your lower back. And then we're going to roll up and now sit up. Okay, so that was your upper and lower back flexibility and mobility session. If you found it useful, then I would be doing this on a regular basis. You could be doing this daily. The more frequently you do mobility and flexibility exercises, the better you'll feel. So there's no limit on how often you do it. Obviously, if it's the only thing you're doing, then you're not going to be getting any cardiovascular fitness or strength gains in there. So make sure it's not the only thing you focus on, but if you are finding that your upper back or lower back is stiff, repeat this session on a regular basis. Even if it's not the whole session, just pick the exercises out that you find really useful and then just keep repeating them maybe a few times a day. Spend 5 minutes at a time repeating the exercises that are useful, just so that you're keeping things moving. Because especially if you're a desk-based worker, you're going to get stiff. And even if you're a manual worker where you're doing digging or if you're painting, then you're in positions for prolonged periods of time, that mobility and flexibility can be helped to overcome that. If you're a sports person, then obviously staying limber and mobile is really, really important. So you've got to keep doing those sorts of exercises for yourself as well. So hopefully you enjoyed that, and look out for the lower body strength session that will be coming up either tomorrow or the day after, and also the advice and education session that's on pacing and avoiding boom and bust. Thanks for checking in, guys, and I'll see you soon.